Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on renal anatomy, each with 4 answer choices and detailed explanations. Renal anatomy, clinical vignettes. 1. Renal blood flow, pathway to the glomerulus. A 65-year-old male with hypertension is found to have renal artery stenosis. Which of the following blood vessels is directly affected in this condition? A. Afferent arteriole. B. Efferent arteriole. C. Interlobular artery. D. Renal artery. Answer D. Renal artery. Explanation: renal artery stenosis occurs at the proximal part of the renal artery, reducing blood flow to the kidney and causing secondary renin-angiotensin activation. 2. Medullary versus cortical nephrons. Which of the following is most characteristic of juxtamedullary nephrons compared to cortical nephrons? A. They have a shorter loop of Henle. B. They are less involved in urine concentration. C. They are mainly found in the cortex. D. They have a longer loop of Henle that extends deep into the medulla. Answer: D. They have a longer loop of Henle that extends deep into the medulla. Explanation: juxtamedullary nephrons, about 15% of nephrons, have long loops of Henle that extend deep into the medulla, allowing for better urine concentration. 3. Kidney layers. Organization. A trauma patient sustains a stab wound to the left flank at the T12L1 level. Which of the following renal layers is the deepest and closest to the kidney? A. Perirenal fat. B. Renal capsule. C. Perirenal fat. D. Gerota's fascia. B. Renal capsule. Explanation: the renal capsule is the innermost protective layer of the kidney. It is surrounded by the perirenal fat, Gerota's fascia, and perirenal fat. 4. Renal segments, surgical consideration. A surgeon planning a partial nephrectomy needs to identify the 5 segmental arteries of the kidney. Which of the following is not a renal segment? A. Anterior superior segment. B. Anterior inferior segment. C. Posterior segment. D. Interlobular segment. D. Interlobular segment. Explanation: the kidney has 5 segmental arteries: anterior superior, anterior inferior, posterior, superior, apical, and inferior segments. Interlobular arteries are smaller arteries within the cortex. 5. Ureter blood supply. Clinical relevance. A 45-year-old female undergoes a hysterectomy for fibroids. During surgery, a ureteral injury occurs. Which arteries provide the main blood supply to the ureters? A. Renal and ovarian arteries. B. Internal iliac and femoral arteries. C. Inferior mesenteric and lumbar arteries. D. Pudendal and iliac arteries. Answer A. Renal and ovarian arteries. Explanation: the upper ureter is supplied by the renal artery, while the middle ureter receives branches from the gonadal, ovarian testicular, and aortic arteries. 6. Ureter course surgical risk. A gynecologist is performing a hysterectomy and needs to identify the ureter to avoid accidental injury. Which structure is most closely associated with the ureter in the pelvis? A. External iliac artery. B. Uterine artery. C. Obturator nerve. D. Uterine artery. Explanation: the ureter passes beneath the uterine artery, water under the bridge, making it vulnerable to injury during hysterectomy. 7. Renal innervation, autonomic control. Which of the following best describes the sympathetic innervation of the kidneys? A. Preganglionic neurons arise from T1-T4B. Sympathetic fibers stimulate increased urine output. C. The sympathetic nervous system reduces renal blood flow. D. The vagus nerve provides the main sympathetic input. Answer C. The sympathetic nervous system reduces renal blood flow. Explanation: sympathetic activation, T10L2, constricts afferent arterioles, decreasing GFR and reducing urine production. 8. Renal embryology. Wilms tumor, a 4-year-old child, is diagnosed with Wilms tumor nephroblastoma. This tumor arises from which embryologic structure? A. Pronephros. B. Mesonephros. C. Urogenital sinus. Answer: C. Metanephros. Explanation: Wilms tumor originates from the metanephric blastema, the embryonic precursor to the nephrons. 9. Renal vasculature, susceptibility to ischemia. Which part of the nephron is most susceptible to ischemia? A. Proximal tubule. B. Distal convoluted tubule. C. Collecting duct. D. Loop of Henle. Answer A. Proximal tubule. Explanation: The proximal tubule and thick ascending loop are highly metabolically active and are most susceptible to hypoxia and ischemic injury. 10. Horseshoe kidney. A patient with Turner syndrome has a horseshoe kidney found incidentally on imaging. What prevents the kidneys from fully ascending during development? A. Inferior mesenteric artery. B. Abnormal metanephros migration. C. Lack of ureteric bud formation. D. Overactive renin-angiotensin system. A. Inferior mesenteric artery. Explanation. In horseshoe kidney, the inferior mesenteric artery traps the kidneys, preventing their normal ascent during development. Key takeaways for renal anatomy. Renal artery stenosis affects the renal artery, not afferent-efferent arterioles directly. Juxtamedullary nephrons have longer loops of Henle for urine concentration. The renal capsule is the deepest kidney layer, followed by perirenal fat and Gerota's fascia. The ureter receives blood supply from renal and gonadal arteries. Wilms tumor arises from the metanephric blastema, nephron precursor. Proximal tubules are most susceptible to ischemic injury. Horseshoe kidney results from entrapment by the inferior mesenteric artery. Would you like a set on